Hiring the wrong medical assistant costs your practice time, money, and patient satisfaction. But most doctors aren't trained to conduct effective MA interviews. Today, I'll walk you through the essential questions that reveal whether a candidate will truly excel in your practice. The right medical assistant becomes the backbone of your practice, handling patient flow, managing documentation, and keeping operations running smoothly. The wrong hire creates bottlenecks, errors, and staff friction. These 5 interview questions help you identify top performers before you make an offer. Question 1. Clinical competency. Ask, walk me through how you'd prepare a patient for a physical exam, including vital signs and documentation. What you're listening for. Specific steps in proper order. They should mention hand hygiene, patient identification, proper vital sign technique, documentation in your electronic health record system, and patient comfort. Vague answers or missing steps signal gaps in training. Red flag. If they can't articulate the basic workflow, they'll struggle in your practice, no matter how friendly they seem. Question 2. EHR proficiency. Ask, what EHR systems have you worked with, and how do you handle documentation during a busy clinic day? What you're listening for. Specific system names. Epic, Cerner, Athena Health, whatever you use. Strong candidates mention real-time charting, using templates efficiently, and staying current to avoid after-hours catch-up. Bonus points. If they ask about your specific EHR system and mention they can adapt quickly to new platforms. Question 3. Patient communication. Ask, tell me about a time you dealt with an upset or difficult patient. How did you handle it? What you're listening for. A real example with specifics. They should demonstrate empathy, de-escalation skills, knowing when to involve you, and maintaining professionalism under pressure. Red flag. If they blame the patient or can't provide a concrete example, they may lack the emotional intelligence your frontline staff needs. Question 4. Multitasking under pressure. Ask, describe your busiest day in your last position. How did you prioritize competing demands? What you're listening for. Evidence they can triage effectively. Strong candidates mention specific prioritization systems, staying calm under pressure, and knowing when to ask for help versus handling things independently. Strong indicator. They should acknowledge that patient safety always comes first, even when efficiency matters. Question 5. Cultural fit. Ask, what type of practice environment brings out your best work? Fast-paced with high patient volume, or slower with more patient interaction time? What you're listening for. Honest self-awareness that matches your practice reality. If you run a high-volume urgent care, someone who wants lengthy patient conversations will burn out. If you emphasize relationship-based care, someone who thrives on speed may clash with your culture. The best medical assistants combine clinical competency, communication skills, and adaptability. These questions reveal all 3. One final tip. Always check references and verify certifications. A great interview doesn't guarantee great performance, but asking the right questions dramatically improves your hiring success rate. If you need additional support or want to explore virtual medical assistant options while you're hiring, visit virtualmedicalassistant.ai for resources that help you build the right team.